What I like about the Fellows Vascular Imaging course is the way that everything has been put together um, and easy to digest, I guess. Spoon feed is not the right word. Spoon feed is, um, it's hard to really describe what you guys have done. The, the imaging component, I think, is the key. When we see a vascular ultrasound, and you're not familiar with vascular ultrasound, it's not exactly clear what you're looking at an image until you really start figuring out the parts. And that's not something that somebody can spoon feed you. That's something that you have to kind of go in and learn, and usually it's in pieces from multiple resources. What I like about Fellows Vascular Imaging, and I think the key word is in the imaging. Um, it is vascular education with imaging as its centerpiece, and that's critical nowadays, because I think if one does a vascular intervention, imaging is obviously a key component of where you're going. Vascular ultrasound is probably the introductory component. It's non-invasive. And from there, one may decide to go more invasive in their imaging choices. But vascular ultrasound is a key. And I think for many people, it may be the hardest to pick up. And the reason is because when you look at a vascular image for the first time, it's not exactly clear what you're looking at. There's a grayscale, there's a color component, there's a Doppler component, and they're mutually exclusive, but they add information. With older equipment, a grayscale image may look like snowflakes on a screen. With modern imaging, the imaging is crisper. But what the principles of vascular fellows imaging have done have taken the imaging, really the ultrasound, to a newer level. It's just laid out in panoramic views, multiple clips are placed together, whereas, so for example, looking at a leg where it would normally be piecemeal, either in cross-section or longitudinal section, the images are piecemeal, like flipping pages on a book, on the old Mickey Mouse cartoon in a book. When you flip it fast, it's a movie. When you flip it slow, it's little pictures. I think what they've done is laid the book out in a panoramic view, so it's a lot more obvious when you see an artery with the techniques you've laid out in your educational course. And then you start tying that image to the epidemiology, the diagnosis, the interventions that are available, and why to do them, and start tying things together in one place. It's really a synthesis of information that is more amenable, efficient to use for somebody who's learning things anew. Probably a good review for seasoned guys too. It's probably a quicker way to review things that you're interested in.